So how should a patient with CSNB be evaluated? First and foremost, get proper imaging, get fundus pictures, and then get specialized imaging, show on OCT scans that there are proper layers in the outer retina, in the inner retina. OCT scans will mostly be normal. Then get blue light autofluorescence, show that it is normal indeed. And then obviously the deep phenotyping also includes the full field flash ERG. And this full field flash electroretinography will show you a typical phenotype, which is the phenotype of electronegative ERGs. The electronegative ERG is a gestalt, is something that you recognize when looking at the trace. When you look at the trace of the combined rod cone response, this is the dark adapted patient's retina reacting to a high intensity flash of either 3 or 10 candela seconds per square meter. What you'll see is an A wave go down, as it should be, representing normal phototransduction, but then a B wave not going up properly, not even getting above the baseline. Now that ascending limb, the B wave, represents the transfer of the electrical signal from the photoreceptor cells up to the next level up, which is the retinal bipolar cell. So that synapse is the place where the problem sits. And overall, with the A wave going negatively down and the B wave not coming up above the baseline, in a positive sense, gives you an overall gestalt of what we call electronegative ERG. When you see that, you need to consider a CSNB gene panel or whole exome sequencing. Again, both of them would be right. Depending on the specific retinal phenotype and electrodiagnostic phenotype, with the ERG, the abnormalities seen in the ERG, specifically in the rod and in the cone-specific responses, on top of what I already said about a combined rod-cone response, will, for super specialists, give a good idea as to whether this is due to either the NYX gene or NYX gene, which is complete congenital stationary night blindness that is X-linked, or the CACNA1F gene, which is incomplete type of congenital stationary night blindness. This is super specialist matter, and you can detect both mutations in the one gene or in the other by using a CSNB panel or using whole exome sequencing.